Where's the first place you're going to lose weight? In your belly. Your belly will go down.
Yes, belly fat is typically the first to be targeted. That does not mean that it will be the first to be eliminated. This is because belly fat accumulation is among the most abundant, and so it is therefore relatively easier to eliminate. Furthermore, you can validate this when you are overweight and you start to make progress, and one of the first notable signs of that progress is how looser your clothes feel.
You just cut down on calories, but you're eating 3 times a day, your hormones are very much the same as they were before. And maybe you lose some weight, but you're going to feel terrible. You're going to lose muscle mass. You will gain back all that weight again in about a month or 2.
Eliminating caloric content but still eating too frequently can work against you because the physiological implications of the food. Every time we eat, insulin rises above threshold. This is normal and supposed to happen. It is what drives the body to transition from using stored fuel to food fuel. It is like if a store receives a shipment of goods, but the manager would rather focus on filling the sales floor using backroom merchandise instead of emptying out the truck.
But when you do it to fasting, you're changing your hormones. You will not lose so much muscle mass.
Muscle mass loss risk from calorie counting is observed because there is minimal muscle protection from a simple caloric deficit, especially from an extended one. With fasting, insulin levels drop, allowing counter-regulatory hormones to rise and do their thing. This also includes the increased concentration of growth hormone, which is effective in promoting muscle from degradation.
You'll have brain-derived neurotropic factor. You'll be smarter, better, brighter. You'll feel better. And you'll lose fat in the right places. So when you lose the fat, your arms won't hang like this because of the skin. You'll lose the skin together with the fat.
Losing fat in the right places is awkwardly worded because that suggests that fat can be spot trained, which cannot. Perhaps he meant that the fat that is lost is the intended fat that you wish to lose. This may make sense because when done improperly, people may find themselves losing fat, but their belly fat may remain disproportionately there. There is validity to the claim that about reduction of loose skin with fasting. This has been observed by patients and studies by Dr. Jason Fung. There have been other claims that it is not the case. I hypothesize this may be due to scar tissue accumulation in the skin. Scar tissue is not specialized and therefore it will not behave like the tissue it has replaced. One of the key characteristics of skin is elasticity due to the protein elastin. Thus, if you have gained and maintained excessive weight for a significant of time, the accumulation of scar tissue will contribute to skin sag due to the lack of elasticity. Arguably, this would be the basis for stubborn loose skin that some patients experience. Some of the parts of this claim are debatable. Extended fasting after 3 consecutive days will yield diminishing returns to the point that prolonged use can actually begin to degrade muscle. The commenter claims that the basis for this is due to a lack of protein consumption, but I would argue it is more due to a lack of growth hormone. Muscle is protected under fasting due to increased concentrations of GH, and this can also be stimulated with exercise. So if muscle loss is a concern with fasting, then it should be coupled with exercise to preserve as much growth hormone as possible. Also, I would argue about their claim about loose skin. The results will actually vary and will depend on scar tissue concentration, among other factors. This I agree with. Insulin is the key hormone that fasting seeks to control. Insulin's presence and absence dictates many physiological processes. One of the main ones is body fat recruitment. If insulin remains below threshold, then the body will have an efficient time pulling fat from storage to be used. But if it is chronically elevated, then fat burning is halted, forcing the body to use other methods to deal with energy demand, such as lowering metabolic rate to minimize energy demand.